the Minister of Health, Terrence Deyalsingh, says he's managed to save the country $250 million by cutting costs on the new Arima Hospital. The minister made the announcement just before a tour of the facility this afternoon. Peter Christopher reports.
Work on the new Arima Hospital is still ongoing, but the Minister of Health told the media that he's managed to cut down the cost of the project.
The budget for this hospital has been reduced to date since I became Minister of Health by $250 million. That's 250 million TT dollars. So you are getting the same hospital with the same capacity, but the taxpayer and the people of Arima are being saved $250 million TT dollars.
The minister says the figure was cut down from approximately $1.88 billion to $1.52 billion after discussions with UDCOT to trim the fat. However, he assures that the cuts will not reduce the level of medical care to be provided at the hospital.
So Arima will be a 150-bed secondary care facility. Point Fortin will be a 100-bed secondary care facility. The new Sangre Grande Hospital, we are yet to decide the exact number of beds, but it's going to be, let's say, around 150, another secondary care facility.
The minister says plans for staffing are already in place, with the expectancy it will be fully staffed by 2018.
The staffing issue there is just incremental because you're moving from the old Point Fortin to slightly more capacity. Grande, you might use the same staff or incrementally more. Where we have to look for new staff will be Arima. So some of the staff from there will come across here, and then we start to phase in the services. By that time, we have already started to work on the manpower plan for doctors, nurses, allied healthcare, and so on.
This plan, the minister assures, was done to avoid a repeat of the issues plaguing the Couva Hospital. The Couva facility is still closed as staff could not be found for the hospital. Peter Christopher, C News.
Minister Deyalsingh is frustrated by the lack of information provided by hospitals concerning vacancies. C News questioned the minister about the high number of medical school graduates who are currently unemployed. The minister said he's still to find out how many qualified doctors are out of the system.
So I have mandated all RHAs, do a manpower audit and tell me what your needs are. Don't tell me you need 50 doctors. That doesn't help me. Break it down and say, okay, I need 3 in A&E. I need 3 people for thoracic care. I need 2 cardiologists. See what I mean? And that is what I am now gathering so we can start to fill vacancies.
The minister says so far only the Eastern Regional Health Authority has provided proper data. He says once the information is provided, the graduate doctors should be placed into public health system.
Once there are posts, either cabinet approved or board approved by the RHAs, they will be hired.